Hi, it's Dr. Matt Harkness with Allied Physical Therapy Wellness Community. Well, I am so glad that you've joined us today. This means that you are making health your priority by watching our videos and learning a bit more each month about your health. Well, this month we are talking about arthritis. What is arthritis? Well, let's start with the definition of the word arthritis. Arth means joint. Itis means inflammation. So essentially, it's inflammation of the joint. Now, according to the Arthritis Foundation, upwards of $300 billion a year is spent on the treatment of arthritis. There are different types of arthritis, and the most common types are osteoarthritis, psoriatic arthritis, rheumatoid arthritis, and gout. All of these types of arthritis can cause stiffness in your joints, inflammation and pain, swelling, and of course results in difficulty in doing the things that you love every day. So what are some of the common risk factors for arthritis? Of course, one main risk factor is overuse. You're using the joint excessively, and lots of motion over time will cause inflammation in the joint. Or too little movement in the joint. You're not using it enough and it becomes stiff and inflamed. Also, your genes or different diseases such as lupus or infection to the joint, swelling can result in arthritis as well. How can you prevent arthritis? Well, some of the common proven ways to prevent arthritis is, first, weight control. Make sure you're at an ideal weight, and extra weight puts more stress on your joints. Another thing is make sure that you balance your activities. In other words, don't just use your dominant side all the time. Use your non-dominant side as well. Sometimes supportive bracing can help to prevent arthritis. A back belt or something, if you're doing work outside, can help to protect the joints so they don't get as much stress. A preventative routine of stretching, of just being aware of things like making sure you're not overdoing it. Good footwear can help you. So consider the toothbrush. We all have a toothbrush at home. We use it every day, morning and evening, and it's just part of our routine. So it's the same thing with our joints. I like to call it brushing your muscles. So one thing that I like to use is what's called a stretch strap. And this is kind of like the toothbrush for your joint. And you can use it, say, to stretch your shoulders, have your arm behind your back, use the opposite arm to stretch the front of the shoulders. Or say a hamstring stretch. On your back, the strap is around your foot, and you lift your leg and facilitate a nice stretch on the back of your legs. Of course, a guide to help you with different stretches is always helpful. And again, I recommend you start with one or two, morning and evening, and then as you get comfortable, it becomes automatic, you can stack on another stretch perhaps. Another thing you could do is use, say, a CBD product, something that helps to relieve pain, stimulate healing. This is a good product to use. Apply this after you do, say, a workout or you do some projects around the house. Even BioFreeze, this is more a pain relieving cool sensation. This can help to relieve pain as well so that you can keep moving. Or say something like a splint, something like this. A common place to get arthritis is in the thumb, and using a splint to rest the joint can also be helpful to use in between, say, work activities where you're having to use your hands a lot, even in sleeping, to keep it in a nice neutral position. So You can use medication sometimes, non-steroidal anti-inflammatories like ibuprofen or Motrin can help. Sometimes in more severe cases, your doctor might prescribe to you steroids to help reduce inflammation. Of course, physical therapy is a very effective way to treat arthritis. As a doctor of movement, we can assess your joints to determine, are they within the normal range? Are they truly at risk for injury and further arthritis? Giving you the proper exercises for you, teaching you proper behaviors, sequencing projects in chunks instead of one long duration, giving you stretches and techniques to keep your joints optimally healthy. In some cases, surgery is required, and conservatively there is too much damage to the joint and you may need a joint replacement, which is done routinely and can be very effective as well. Like you go to the dentist twice a year, get your cleaning, the dentist inspects your teeth to make sure that you are not developing any problems or at risk, or better yet, you need some intervention like a filling or something like that. Same with your doctor of movement. You should come and see us twice a year, have us look over your joints, ask you questions about how you're functioning, determine do you need a few sessions or maybe a larger group of sessions to get you back to what you love, and of course to make sure that you're still flossing your teeth or brushing your muscles, doing some appropriate exercise, using a supportive brace or something to keep yourself lasting for as long as possible. So remember to share these videos with a friend, and also you can subscribe to our YouTube page. And I want to say, if you feel like, gee, I should come in, but I'm pretty busy, do not hesitate. Click on our website, fill out the information that you want an appointment, or simply give us a call. We'd love to see you. Don't sit there and suffer any longer. We can help you, I promise you. So thanks for watching, and we'll see you next time.